area of the back doesn't relate to the heart. Okay, from about T4, T3 to C7 is not heart. Doesn't relate to the heart. In fact, not at all. And so a lot of times people who really do some like chakra focused work on emotional issues and areas of the body and talking about emotional blockages here and there, they always kind of lump this in together as if it's all heart issue, but it's not. From about T3 to C7, it's a fifth chakra issue. Fifth chakra issue. This has to do with failure to communicate.
Wow.
Okay, that's what this is about. Failure to communicate. Communication and expression of being, primary qualities of fifth chakra. Okay, front and back. Run this as a belt, a girdle, all the way around. That's the upper part of the lungs, okay, and the brachial passageways, including the larynx, esophagus, okay. So by the way, acid reflux manifesting with ulcers and what in the esophagus, esophageal cancer, and so on. It's all fifth chakra stuff, okay. And so this is about actually getting your mouth open. But of course we know communication and expression is not just about speaking. Mm-hmm. You know, we can say it's about speaking your truth. Okay. Another reason to vocalize undeclared issues. To vocalize undeclared issues because it brings energy to this. It brings consciousness to this girdle, fifth chakra girdle, I call it. Fifth chakra daima, the fifth chakra belt. Okay. And so I want to always not to skip over this and let it go light. All right. Now, in classic Thai, of course, we don't. So when we say neck in the side-lying position, what we're talking about is from about T3, T4, all the way to the atlas occiput. All right. So that's the entire length of the splenius capitis or splenius cervicus. It's the entire length. Okay. All right, so from here, now when I was working on the back, I was pushing in close to the spine and rolling away from the spine. Okay, so my angle of attack was in and away from the spine. When I go to work on the neck, find that highest, and where this point starts is you just locate the upper inside corner of the shoulder, drop straight down to the spine. That's the first neck point. Okay, all right, so what I'm going to do is I'm going to step on her head. No, I mean step over her head. So it's step over, but not on. I'm going to capture her shoulder and bring it down and away a little bit from her ears. You know, some clients, when you put them on the sideline position, their shoulder is bulky and collapses literally on top of the neck, even sometimes going as high as the ear, right? So it's in the way, right? So I want to get a hold of that shoulder and pull it down and back. And I have her slightly forward. Okay, so I don't want her perfectly straight in this position. I'd like to see her fairly forward, okay? And then I'm in my good lunge. And notice a straight line, shoulder to thumb, and I get my arm as tight to my pelvis as I can, right? Because I'm not going to push down. The way I'm going to work these muscles is not push down. Now further clarification on where I'm at, okay? In the center of the back of the neck, okay, we have the spinous process, and that's the part of the vertebrae that you can feel in the middle of the back of the neck, okay? Spinous process. That's the short one, short and rounded, okay? Now, square, perpendicular to that, on the side, if we push in here, we can feel another bump, okay? But on the receiving side, okay, it feels sharp when I put pressure on this. It doesn't feel the same. That's why I put finger pressure on the spinous process. That doesn't feel sharp. On the side here, that feels sharp. Now, on the side is the transverse process of the vertebrae. Transverse process. Unlike the spinous process, the transverse process actually comes to a point. Actually comes to a point. So when I compress on the side of the neck here, the tissue into the transverse process, of course, it's going to stab, and that's going to hurt. All right, somebody asked me earlier what was the SMOKH, one of those techniques, you know, like the SMOKH death grip or whatever, okay? Well, one of them is actually if you grab the side of the neck and just squeeze onto the transverse process, you can create incredible pain, okay? Now, my objective here is not to create incredible pain. I always say my objective in my sessions is not that treatment with me is the most painful experience of that person's life up to that point. That's not my goal, okay? So I do a lot of things that I'm sorry, some things are painful, but I do a lot of things that are actually very carefully done so that I can create as much pressure as possible with as little pain as possible, because I want that pain and discomfort to be incidental, all right? But if I'm in the wrong place, it's not incidental, is it? It's a direct result of what I'm doing, okay? And even someone who was perfectly healthy, perfectly balanced, and the energy was perfectly flowing, if I grabbed that point and gave it a squeeze, they would yell, because it would hurt so much, okay? So what I'm looking for is to split the difference. So here's the transverse process. Think of, first you have to visualize the square angle. Center point of the spinous process, and then at right angles sticking out, the transverse process. I want to be on a 45-degree angle, and I'm kind of pointing into the base of the vertebrae, between the spinous and the transverse. Okay, those are my landmarks. Now that also, another way to recognize if I'm in the right place, of course, is when I push into this, it is muscle, so it should be mushy. I should be able to feel a little give. Now, granted, if you've got someone who's got spinal cord injury, whiplash, military neck, chronic and acute spasm in the posterior cervical muscles, those muscles may in fact feel almost as hard as bone. They're so locked in spasm, and they have a lot of calcium in them. So they're going to feel really hard and resistant. When you first put pressure on them, sometimes you're going to work on someone, and you're not going to hardly be able to find a soft spot, okay? Because it's so ropey and rigid and spasm, okay? That's why the landmarks are important. Because even if this feels like bone, if I know I'm halfway between the vertical process and the transverse process, no matter what it feels like, I'm in the right place. Okay, so that's why why we think the landmarks are important, okay? All right, and then from energy point of view, of course, this line is part of the bladder meridian, okay? Part of the bladder meridian, but also Senita and Senpingala, which come over the head, okay? Now, here's what I'm going to do. So I'm not going to push down, so I have to have another way to have pressure. I've got the shoulder, I'm on, I follow that inside corner of the shoulder blade to the spine and come up just a little bit into the muscle head, and that tells me I'm in the right place. I'm not pushing on the bone, okay? And I get a straight line from my shoulder to the end of my thumb into the point that I want to work. And all I'm going to do is, as I exhale, and because I always exhale, that's part of every technique. Like sometimes I forget to say it every single time, okay? But every single time I apply pressure to the body, I exhale, I do a pranayama, I'm practicing continuous breathing, and my visualization is that the pressure is an extension of my breath, no matter what I'm doing. I don't always say it every time, but every time I do it, that's actually what I'm doing, okay? Now, so when this knee moves forward, the hand will go down. See, I'm not bending over. And this is how I keep my center into the work. See? My pelvis is into the work, my belly is into the work. And see how I've got my arm is kind of locked in here between my belly and my thigh? Okay? And so if I don't move this knee, if I don't drop my pelvis on top of this point, there's no pressure. Nothing happens, right? Because I'm not going to bend over. And then it doesn't matter how big or small the client is. She could be 2-3 times my size, 2-3 times my size. If I use this technique, I will feel like a ton of bricks going into those points if I want to. But the nice thing about it is the nuance, is the finesse, because these points tend to be very sensitive. Okay? So I want to be sensitive. Whenever I have my client in a position where my pressure is highly likely to create or support sensitivity, then that's when I want to pay attention, and I want to be sensitive, and I want to be relaxed. I don't want my hand to be straining while I'm trying to decide if the tissue is giving or not. Okay? So here I go, and I just rock in, move to the next point. Now, the neck points in this position are the width of your thumb apart. And see this back and forth rocking? It's not up and down, it's back and forth. But she feels the strength. I don't feel very much because I'm relaxed. I will feel it if she starts to tense, flex, defend, ward, or otherwise try to escape because I'm putting too much pressure. I'll feel it. Why? Because my hand's relaxed. And all my fingers are touching on the back side of the spine. So here we go. Just up and up, up. Okay, all the way to the base of the cranium. Okay, in other words, as high as I can go and still have any idea that I'm on the neck. That's how high I go. Okay? Now, from there, I'm going to work the cranial base point on this side. The cranial base point on this side. In acupuncture, we call this point gallbladder 20. GB 20, gallbladder 20. Okay? But it's one of the 3 occipital points, or 3 key occipital points. It's also a marma. Okay? And the way I'm going to work that is I have to visualize her head as round as a ball, because the pressure is going to go from that point toward the geometric center of her cranium. All right? So this is following that rule. The pressure is angled or directed toward the center of whatever body part you're working on. It's why we change angles when we do thumb pressing on the legs. Is because I'm trying to aim at the center of the body part. Okay? So if the cranial base is what I'm working, I'm not going to push this point into her neck. I'm going to push up and in as if I was aiming for the geometric center of her cranium. Now, what's in the geometric center of her cranium? There's actually something there. So I have something to aim toward, right? And so like Katie said, the pineal gland. Okay? Now, the way it works is the bones, the cranial base bones that the ear is attached to, okay? They're called the sphenoid. Okay, the sphenoid bones, the base of the cranium. So here's the side, the wings. I call it, it's like the bat. Okay? Here are the wings of the bat. Okay? And at the body where my palms are open, that's the foramen magnum, where the spine comes out of the cranium. Okay? Where the medulla oblongata drops down into the spinal cord and so on. All right, that's right there, the base of my hands. Where my thumbs are crossed, okay, right there in the seat of where my thumbs are crossed is the pineal gland. So it's right in the geometric center of my cranium, okay, from this angle. And so it gives me something to visualize. You can look up what's the pineal gland, what is it good for, what's its function, and I can say it in 3 words, sorry. Master hormone regulator. Master hormone regulator. Okay? And so I'm directing energy at this point in my cranium that is the seat of responsibility for the manufacture and distribution of hormones in the body. So it's kind of an important point to be able to identify, right? Now, the way I'm going to work this is I'm going to drop back so that my whole body presentation is on that line, and I'm just going to push up and in. See, it takes a long time to talk about, but it's really easy to do. So I'm just going to push and hold that point for 5 count. 1, 2, 3, 4, 5. Circle out to release, and then palm the head with a big hand and big sloppy thumb circles over the ear. And this is zip, 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 is small intestine. Okay? So this area of the cranium relates to the small intestine. But let's just do a big grindy thing. Now, if you listen, you can actually hear this sound, which is the hair being ground. Listen. You hear it? Mm-hmm. Okay? As I'm sliding over the hair, grinding it into the small intestine, it's doing what? It's creating a pressure wave, vibration. It's creating a very, very fine vibration, okay, which is dispersing energy in the small intestine, releasing energy in the small intestine, okay? Note to self, gallbladder 20, and these circles on the small intestine, or temple, okay? Really good for headaches. Okay, really good for headaches. All right? Okay, now from there,